Hi, welcome to the Pinoy RN, a podcast that provides insight into a variety of subjects relevant to Pinoy nurses. Here's your host, Jerome Babate.
Okay, so I'll introduce first our startup or our company. So Meta Health Innovations and Insights. Um, Meta is short for M is management, E economics, T technology assessment, and then A is analytics. All for health because we would like to focus on public health and offer a solution to several public health challenges in our country. So all of us are Australian educated group of friends. So we lived in Sydney for some time and we are all public health practitioners and we came up with an idea of starting a firm, a research or consultancy firm when we go back to the Philippines. So we would want to focus on the complementarity of our skill set and expertise. So our Robert, one of our colleagues, our chief data scientist, is a statistician. Our CEO, Jason Alacapa, is a nurse doctor who also took a management course in AIM before he studied public health in Australia. And then Paul, he's studied in College of Public Health in UP Manila before he took his Master of Public Health in Australia. So three of us also had an opportunity to join a startup competition in Australia. So mine is with the University of Sydney. I got access to a pool of mentors in different fields, mainly in business and entrepreneurship, through the Sydney Genesis program of the business school. And then Jace also joined a startup competition in University of New South Wales. Actually, it's a nursing intervention or nursing app that I showcased when I joined the startup competition in University of Sydney. So it's named Ondago, but it did not fly. We did not pursue it because when we came back, we found out that there's already um, a market or an app serving for its purpose. So we decided not to pursue it anymore because one of the lessons we learned when we were in Australia doing the startup mentorship is the first mover advantage. So when you are the first player in the field, there is a huge advantage already, and the the app that I am talking about has been bought already by Ayala Corporation. So it's a huge company that we will be competing with. So we did not pursue it anymore. But this idea is focused on the complementarity of our skill set, the meta health, and I, I'm a management practitioner, and then all of them are good at technology assessment and economics, and we'll be bringing all of this expertise um, in this industry or in this market, public health. One of the biggest hurdles that we have is schedule. Two of my colleagues are studying PhDs, are taking their PhDs in Australia. So Robert and Paul are both studying PhDs now in University of New South Wales. Then only two of us are here in the Philippines. I have a full-time job at the Department of Health, so I cannot devote my 8 to 5 time to Meta Health. So I do it after office and during weekends. And then Jay is our CEO, is doing a lot of consultancy work and volunteer programs in different organizations. So all of us are busy, and it's really difficult to find a common time for us to discuss and iterate our ideas. But after months of discussions, because maybe we are very much prepared to work um, in this time of epidemic or pandemic, where we do a lot of Zoom calls at the moment and other um, video conferencing platforms. So that time last year, when we were discussing how we can improve our idea, how we will set up Meta Health, we've been using a lot of video conferencing platforms already. So we're very much prepared to this pandemic. So that's one thing. Schedule is an issue. And then number two is going through the business registration process. Of course, this is very important that um, our company should be SEC registered. So went through the process of business registration, and sometimes the documents have to come um, from Australia first because they have to sign it before we submit it to the SEC, and then we hired a firm that will do the legwork for us because all of us, as I said, are very busy with our work. And then we also did a lot of iterations and prospecting of the market, um, discussing the business model, discussing the market, the stakeholders, etc. I think this is the fun part because this is where we throw our ideas in so that we can improve our business and our position. What's gonna be our position when we launch this year? So we just did our soft launch um, a week ago through our social online platforms, and yeah, so our next step is to prospect for clients and other partners that will help us sustain the company. Actually, Meta will focus on, for the first few years of our operations, on technology assessment, um, or HTA, health technology assessment, because we see that there is a huge potential for this market um, under the Universal Healthcare Law, which has been passed last year. All of the health interventions, health products, and medical services should undergo health technology assessment for it to be reimbursed by PhilHealth or for it to be funded by the Department of Health. So, so there is a scant number of practitioners of HTA, or more specifically health health economics in the Philippines. So we want to maximize this window of opportunity wherein the government will do a lot of um, health technology assessment. So our role will be, we will serve as a bridge for the private sector who wants to their intervention to to be funded by the government, and of course the government. And the ultimate goal of this is to in, increase the accessibility of our fellow Filipinos to health interventions and medicines using these different tools. Um, but going back to your question, analytics is also important part of Meta Meta Health, especially we see it as this will be the heart of Meta because everything now parang, parang analytics is a cross-cutting area for Meta Health. And now we believe or I personally believe that we're crossing an era already of data-driven um, policies or data-driven decision making. So before kasi the buzzword is evidence-based practice, or we look at the literature on what are the best practices, or we look at the literature in order to build our strategy. So what does the literature say on, let's say, infection control? So what are the different best practices, good practices done in other institutions in other countries to improve infection control, for example? So now the evidence-based practice can be what they call this improved further, or by looking at intrinsic data of our organizations. So because there is a clamor now for digitalization, so we get real-time information or real-time data on our on different areas like patient care, um, organizational strategy, organizational interventions, and then we look at the metrics and see if our strategy really works or not. So analytics or data analytics complement evidence-based practice by providing you a real-time or by providing you real-time information on what is if your strategy is working or not. And in this time of COVID pandemic, analytics is very relevant in public health because people now clamor for faster updates, fast for better data management, and clear data visualization, presentation, and communication. So we we will see a lot of traction on the data analytics um, field, especially in public health. And actually, there are a lot of practitioners already in the Philippines. And when COVID came, there are a lot of volunteers. We set up a Viber group on COVID data analytics who are doing the dashboards and data visualization that we are seeing on the TV, on the social media pages of the Department of Health and other government agencies. So so that we can clearly communicate what the situation, the COVID-19 situation of the country to the public and to the other um, policymakers. Actually, health information system in the Philippines, I think, is still fragmented, and one of the major factors is that we are an archipelago, so there are more than 7,000 islands in the country, and there are different islands having having different internet connectivity. So there are islands or there are areas in the country with strong internet connection. There are parts, especially in the remote areas, where there is very poor internet connection. But still, we enjoy to be the most active nation in terms of social media, and more specifically, Facebook. So there is a digital divide um, existing in the Philippines. And sometimes the internet connectivity becomes more challenging when disaster events occur. So, so it has a lot of impact on the way we collect the data and more, especially the way we generate reports. Some of the data-driven reports which should aid in our planning and budgeting are delayed. One good example of that, this is even during the normal times. One good example of that is the our FHSIS, the Field Health um, Epidemiology Survey that provides the health administration data of different health facilities in the country. So how much um, it it provides information on the interventions provided by our issues on specific locality or provinces, etc. So it's 2 years delayed because there is a need for quality assurance or data quality checks and data cleaning aside from the delays related to data collection. So we have our annual planning and budgeting cycle in the government, and if the report comes after 2 years, then we will not be able to use it specifically for the next round of planning. So we look at the historical details or historical data from the previous reports. So those are the types of challenges that we have. But of course, there is an opportunity ahead of us to closing the gap on digital access, especially data collection, because I think we are all in the COVID-19 pandemic. There's a huge pressure for the local government and the national government to communicate more efficiently. So communication lines are streamlined and communication systems have been improved, and so it all types of barriers have been somehow lessened when it comes to communication, so that we can easily transmit data and information to the different policymakers as well as the public. And good example of that is the reports on the PPEs, because people are so worried about our frontline health workers. Um, Hospitals submit daily information now on their inventories of PPEs to the Department of Health, so that POH can include it in the tracker that can be accessed by the public. Now, if you look at the DOH website, you'll see their information on the stocks of PPEs by most of hospitals in the country, so that the donors would have an idea where to allocate the their donations on PPEs. And it also helps us at the Department of Health plan where to channel their remaining procured PPEs as well as donated PPEs facilitated by the Department of Health. So those information becomes becomes available because of the pressures of our current situation. So another is, given the new normal of us doing less physical interactions and focusing more on digital platforms for communication, there will be more research and technological advancement to improve the communication, digital communication, and data collection, which will not necessitate physical interaction. So times are changing now, and we really have to ride the wave in order for us to be relevant. And I think Meta, uh, which will focus on analytics, technology assessment, and use these different platforms and tools to help our policymakers and decision makers manage their strategy, manage their organizations. I think we are in an era where mental health will become relevant. The advice that I can give to nurses who want to start a company or just follow your dream and chase your idea. Um, but of course, will only your dream will become a reality if you will work hard on it. So know first what are your passions, and if you have a burning idea or burning passion to something, then work hard on it. Always think about it and think about the solutions and how what you can offer. I think that's one thing that is not taught to us ju- in our nursing education, because it's really focused on the on providing nursing interventions, the leadership and management that has been taught to us is also focused in the hospital setting. So we are not geared towards being entrepreneur or even doing nursing independent nursing practice. Um, if you want to be a nurse entrepreneur, or if you want to start the revolution of independent nursing practice, you have to get out of your comfort zone. You have to expand your horizon, and you have to um, learn more other skill set. So now um, I'm still in the health sector, but doing less, almost super scant on the nursing intervention while working in the Department of Health. But when I studied in Australia, I learned more about business models, finance, economics, strategy management. If you want to become a nurse entrepreneur, have to be well-rounded, because because knowing a nurse or doing nursing intervention will not be enough, because you need to find a sustainable way to to um, to sell your idea, and to ensure that your product will become relevant to the public. I believe that for the nursing profession to be more relevant in the coming years, we need to inject innovations and entrepreneurship in our curriculum, because now the market is more and more and more focusing on the primary care, so outside the hospital setting. So we need to make sure that the nurses are geared towards primary care and providing interventions that are not ordered by the doctors, or to be carried out. So nurses have to be sustainable on their own, and this is these these are the things that I think will change the landscape of the nursing profession if we will be able to pull it off. So in short, for nurses out there who want to start a company or create a product that will help solve the patient care challenges, or um, nursing care challenges, or even their organizational issues, then chase whatever idea that you have or passion that you have, then work hard on it, and always engage your most important stakeholder, which is your patient. I think that's it. Thank you very much.
Well, that's all for today's episode of Pinoy RN. Thanks for listening, and thank you to our guest for joining me today. Join us again next time when we talk about Filipino nurses and nursing. Make sure you subscribe to the Pinoy RN podcast on YouTube so you never miss an episode. Also follow us on Facebook at Pinoy RN Podcast. Special thanks to our event partners, Beta Nu Delta Nursing Society, Filipino Nursing Diaspora Network, Nursing for Humanity.